T-Bone and Heather in the morning on Star 98.3 and 97.7 The Bay.
It's 5 minutes after 8 o'clock, 8:05. Good morning. Welcome to the show. Thank you so much for making us part of your morning. We appreciate it. And we are thrilled to have Dr. Polsky back in the studio with us this morning. Thank you, sir, for dropping by.
Good morning. Thank you very much for having me back.
So nice to have you.
Always a pleasure. And I've got the window open, so we got a good draft going through.
Ventilation
We're all
happening.
ventilated and whatnot. So, obviously, we'll talk about what is first and foremost, or has been first and foremost in your world as of late, and that is the pandemic and how things are shaping up. What are you seeing on the home front?
We're certainly moving in the right direction.
Right.
Each week we see more and more people getting vaccinated. I know in Calvert County last week we had about 2,500 people get vaccinated, many of whom were teens. We're actually already up to about half of all 16 to 18-year-olds who had at least a first vaccine.
Wow.
And a quarter of all 12 to 15-year-olds.
Oh, my gosh. So the kids in Calvert are getting vaccinated.
Right. And we're working out something with the schools. I know St. Mary's, and I think in Charles County to some degree, that we're working out with the schools for next week to go into the middle schools to make it more available for working parents who may not be able to get their children to a site.
What is there any, do you find a lot of vaccine hesitancy with the kids, especially, 12 and older?
We really haven't seen much of a problem to this point, and I think the kids, for the most part, reflect the views of their parents.
Right.
But we have not been hearing from our school system, from teachers, from administrators, that the students themselves have voiced real concerns about the vaccine.
That's awesome. I have a question for you because I have a friend who this happened to recently. Her husband went and got vaccinated after the second shot. He got shingles, and somebody, I'm not sure, some healthcare provider somewhere said, well, that's not uncommon, or made a reference to that can happen if you get the COVID vaccine. You can have shingles. I don't know, explode on your body. I don't know what shingles do, but I know that it was painful. Are you seeing that with the vaccine, or?
There is no cause between getting a COVID vaccine and getting shingles outbreaks. And I think it's important to keep in mind that the chickenpox vaccine, which is chickenpox, eventually, if you get it as a child, then you're susceptible to shingles when you get older.
Right.
The chickenpox vaccine wasn't available until the mid-'90s. So for people 40 and over, almost everyone had chickenpox.
Yeah.
About 1 in 3 people at some point will get shingles in their life if they don't get vaccinated for it. And stress tends to make people more susceptible. So the vaccine itself won't.
I'm totally getting it.
Yeah, the shingles vaccine.
100%
oh my
chance
gosh, yes.
I'm getting that vaccine.
And there are hundreds of thousands of cases of shingles every year across the country. So sometimes it just can be coincidental.
See, we had discussed this earlier in the week, and I'm so glad you bring that up, because now the CDC is investigating inflammation in kids, in their heart inflammation in kids 16 and older after the vaccine. And I had brought that up to you. I said, hey, listen, I may ask you this question because, it's in the news about these cases of kids getting it and they have heart inflammation. And you had a great answer for me. And a lot of it could be coincidental, because why?
So myocarditis, which is an inflammation of the heart muscle, is not a common problem, but it's not rare. So at least 70,000 cases occur in this country every year. And it's much more prevalent in males and females, about a 3-to-1 ratio. And it's sort of counterintuitive, because when we think about heart problems, we think about people in their 60s or 70s.
Right.
But myocarditis happens most commonly in young males, most typically between ages of 15 and 20.
Okay.
And then the next most common group is early 20s. So, but for an individual physician, they don't see a myocarditis case very often. So 70,000 cases across the entire country.
Okay.
Means that so when a case presents, it's not typical for that physician. They're going to report it to the reporting system.
Oh, I see. Yeah.
But now when we see, as I mentioned, most of the vaccines that we administered in Calvert last week were for young people.
Right.
So across the entire country, and we have not seen any myocarditis cases in Calvert. I want to make that really clear.
Great.
But across a very, very big country like ours, you're going to see over 1,000 cases of myocarditis a week just as background. This is just the norm.
So people who get shingles or kids who get this, it could be coincidental, and then people panic because they're like, well, I just got the vaccine, so maybe this did it, when actually you were going to get it anyway, whether you got the vaccine or not.
Right, and think about a car. If somebody gets injured in a car crash, if somebody got a vaccine the week before and then got into a car crash and got injured, we would not say the vaccine caused them to get injured in a car crash.
You would, I would.
Right.
So let me ask you this. From a medical perspective, I don't really know how to phrase this. Are you guys paying just like uber attention to everything at this point, trying to gather data as to cause and effect when it relates to this vaccine? Is there more of that going on, or are there just more people screaming about it?
That absolutely goes on. And so the goal of every physician, nurse practitioner, CDC, FDA is to keep people safe and healthy.
Right.
So anything that happens initially, it may just be coincidental, and oftentimes is, but there potentially could be some cause and effect. And I would get back to the Johnson & Johnson vaccines, that those rare blood clots caught people's eye because those truly were rare. And so now we know that especially for women under age 50, that the best choice for them would be to get one of the other two vaccines which have not been associated with those blood clots. If people weren't paying really close attention, we wouldn't know that, and we couldn't offer that more advice that would be specific for individuals so they can make the best choices for their health.
All right, so if you have a question for Dr. Polsky, you could call up this morning at 1-800-STAR-983. That's 1-800-782-7983, or you can call 301-884-4615. Go ahead,
hopefully, well, I was just going to add on to that. Hopefully, I don't think it will, but hopefully this will be able to put out some fires from what you've seen on the internet and what your friend's neighbor told you happened to her sister.
Okay, hold on. I got a question. And on those lines, TikTok videos all over the place.
Oh my God.
Magnets.
Have you seen these?
Refrigerator magnets sticking to the injection site.
So I do my best to stay away from social media. It's for my mental health and well-being.
Yeah. Yes.
But no, absolutely, there's no metal in these vaccines. And if anybody has any skepticism, they're welcome to come by our vaccination site, bring a magnet with them, and hold them right up to one of our injection vials. It will not stick.
Oh, that's a good idea.
It's a great idea.
Yes, it is.
There's just so much of that out there, and so much of it is simply based on getting likes and getting maybe... It's ironic that you would call it going viral when you're talking about a virus, but
right, exactly.
There's so much of that, and it's... Boy, it's got to be tough from a doctor's standpoint to deal with a pandemic and then to deal with this pandemic of misinformation that is just raging.
I mean, I'm sure you're dealing with that on a daily basis, and you just are so calm, cool, and collected all the time. It must drive you nuts when you hear people like me say, hey, have you seen the video where the magnet sticks to the injection site? I mean, how do you, as a healthcare professional,
not just say, no, stupid, that's not how it works.
How do you deal with that, and how do you try to calm a populace that is already uber on edge when it comes to the vaccine?
This is an important part of healthcare. Educating people. I always had two goals for my patients when they would come into the office. One is that physically, whatever was wrong with them, that we make the best diagnosis and treat as best we can. But the other is that it was always important to me that my patients left the office with at least one new thing they learned about their health in general so that they could take better care of themselves. And it was clear because when I started practice, social media didn't exist, but it came in fairly soon after that.
Right.
And of course, the amount of information continues to increase. And especially during pregnancy, I would tell my patients that I'm not going to keep you away from social media and I'm not going to keep you away from the internet, but you should always have a lot of skepticism, especially when something really strikes you as that doesn't quite seem right. But if you have questions, if you think it's going to impact your decisions and your health, that I want you to call me, I want you to come in, whatever, and we will talk it over and see what's right.
So talk to your primary care physician if you have one. And what about people who don't have a primary care physician? I mean, what would you suggest to them? Get one.
Get one.
It's so important.
And it's not just for this. So we know that when people have access to regular care in all sorts of ways, it's not just that they live longer, but they are healthier, especially as they get past age 40, 50.
Right. Yeah. T, I think you have some calls.
All right. Let's see here. Hi, good morning. You're on with T-Bone Heather and Dr. Polsky. What can we do for you?
Hey, good morning. I have a question for the doctor.
Sure.
What is the truth to the supposed rumor of this thing called shedding, where, like, when you get the vaccine, it is possible that if you're around someone who's highly susceptible, an elderly person, something like, immune compromised, that you're like actually maybe putting out a little bit of that virus. Yeah, during that time period after you get your shot.
Oh my gosh, I haven't heard that. Great question. Thank you so much for the call.
And that is a great question because there are some older vaccines where people can shed virus, but the COVID vaccines are not. And the reason for that is that there is no actual COVID virus in any of these vaccines. So it is impossible. When I got vaccinated, there was no COVID virus in me. So I got one of the mRNA vaccines, and so that codes for a specific protein, but not for the entire virus. So there is no way for me to spread to anybody.
Oh my gosh.
So it's kind of trying to trick your immune system into building up a defense for this virus, but it's not the dead virus like some of the older vaccines.
Flu.
Right. We all had when we were kids, which was like the dead virus, right?
Absolutely. This is a way to get your immune system respond without exposing it to the entire virus. So and just really quickly, that there are two types of flu vaccines. One of them has dead virus, that's when you get a shot, and the other has live virus, that's the spray. So we do we caution people who have immune system problems away from getting the spray, because although that live virus is what they call attenuated, which means it is treated in a way that would make it very, very, very unlikely to cause illness, it's not 100%.
I gotcha. Okay, caller, that's a great question.
Good
Thank
question.
you so
Thank you for the call.
much. Thank you.
Yep. Thank you too.
Bye-bye. I didn't hear
never even
that.
heard of
I
that.
never even heard of shedding.
Right. So so the live
I thought
virus.
it was like shed your skin like a rash or something.
Yeah,
No.
so the spray, the nasal spray is only approved for people under 50 because more immune problems for people older, and for younger people who have immune system problems and pregnant women, they only will get the shot. They will not get the spray.
Okay.
All right.
Wow. Good to know.
Hi, good morning. You're on with T-Bone Heather and Dr. Polsky. What can we do for you?
Hello. Hi. Good morning.
You're on the air. What can I do for you?
Okay, I have two things I want to ask.
Go.
Number one is it true that you cannot develop a vaccine if there are therapeutics like ivermectin and hydroxychloroquine?
I'm not quite sure. When you say develop a vaccine, do you mean can researchers create a vaccine?
Yeah, I don't think I understand the question.
I have heard that it is illegal to put forth a vaccine if there are therapeutics.
Oh, if there's medicine for it. Oh, okay. Well,
so first off, there's no laws against creating vaccines, and it's always a goal in medicine to prevent people from getting sick, not wait until they get ill and then try to treat things.
Okay.
Because there has been in St. Mary's County, because when they announced you're not allowed to get hydroxychloroquine if you have COVID. I went to CVS that day over a year ago, and the woman said at CVS, you are not allowed to get this drug if you have COVID.
Huh.
Well, and that's a different situation completely aside from vaccines. So the hydrochloroquine was shown not to be effective.
Okay.
I have heard that you're not allowed to have a vaccine if there are therapeutics, which would explain why they don't want to see it.
Well,
okay, the second thing is, this is number two.
Sure, go ahead.
VAERS data set, vaccine adverse event reaction system. Have you seen that?
Yes.
Did you know that over 4,000 people are reported dead due to the COVID vaccine?
So that's a misinterpretation. So first off, the VAERS system was really created for clinicians. It was not intended for the lay public.
So is it THAY, T-H-A-Y?
V as in
like
Victor.
V.
Yeah.
V. Gotcha.
And so as we were discussing earlier, anyone who has a vaccine and then something happens with their health, that any physician, any nurse practitioner, and actually you don't even have to be a physician or nurse practitioner, can report into the VAERS system. And then the FDA and the CDC then takes a look to see if there was a true cause and effect. So to this point in time, there has not been a single death that has been caused by any of the COVID vaccines, with the exception of those, I think, somewhere between 4 and 6 people had blood clots from the Johnson & Johnson vaccine.
Right, the women.
Yes. Gotten a vaccine, and their grandfather died the day after. My friend's father died 2 days after. And so there's a lot of reporting, and I encourage everyone to go, and you can see this. It's public knowledge. The vaccine adverse reaction system.
Okay, thanks for the call.
Now, that's an interesting point because what you said in there it caught my ear. And I'll tell you why it's interesting. I have said this all along, and I've said this many times on the program. We have reached a point in our human condition where up until this point, there's been no such thing as too much information. We've been on a constant quest for information. Now, I believe there's too much, and some of the information gets disseminated out to the public. And it's no reflection on anybody's intellect. You don't have the tools to decipher that information correctly because it's not what you deal with.
And and I understand, but I understand what she's saying. That, you have a friend whose grandfather got the shot, they died the next day.
Okay.
Well, how old was he? Did he have a heart condition? Was he convalescing? I understand what she's saying, but that's how...
Well, I think
rumors get started, and
I think we've opened a box here because the lines are going bonkers.
Let's go. Let's do it.
All right.
Let's do it.
Hi, good morning. You're on with T-Bone and Heather and Dr. Polsky.
Good morning.
Good morning.
Dr. Polsky, I have a nephew and his wife that both got infected like in March with the coronavirus.
This past March or the March when it all began?
This past March.
2021.
Okay.
Gotcha.
They're both over it now. They want to come down for the 4th of July. I asked them if they got the vaccine, and they said, no, we don't need the vaccine. We already had it.
Great question.
They're using the Rand Paul defense.
Okay. Any merit to it?
Variants of this stuff that they can be infected again?
Okay, great question. Love this one.
That is a great question, and that is a nuanced question.
Oh.
So your nephew and his wife will have a good amount of immunity. It was only a couple months ago that they got infected. The chances of them getting reinfected within this next month or two is very, very small.
What about the variants, Doctor?
Before we get to the variants,
Sure.
I will say that research has clearly shown that, and we talked about this, I think the last time that I was here, that when people have get naturally infected, that they do build up a good amount of antibody. When people get the vaccine, their antibody levels are about 2 to 3 times higher, and the antibodies persist longer with the vaccine. So the concern that we have is that over time, when will people start to become susceptible again? We know that coronaviruses in general, some of that family causes colds that people can get reinfected.
Right.
So the general recommendation at this point is not from Rand Paul, but that people should, despite getting infected, they should still get vaccinated because that will certainly prolong their immunity. And then we get to the variants that both the Moderna and the Pfizer vaccine in particular have shown to work very well against all the variants that have been circulating within the U.S. The Johnson & Johnson maybe not quite as much. And so when someone is naturally infected, if it was with the original strain, that may not protect them as well against the UK variant and some of the other variants that have popped up.
Don't invite them to the picnic. That's the thing.
Invite them.
I've been vaccinated, so I'm safe against them, right? In other words, I can invite them down.
Yeah, I think you'll be fine. And
okay.
Yeah.
That was my... Thank you, Doc.
Invite them down.
I noticed we didn't get an invite.
Yeah,
but,
thanks a lot for that.
Thanks a lot for that.
And the other nuance real quick is
Yeah.
that for people that have underlying immune system problems,
Right.
that particularly I would recommend that they get the vaccine if they have been infected before, because everything we can do to make sure their immune system is boosted up as much as possible is truly in their benefit. And again, they will not then potentially pass on to anyone else.
Gotcha.
What's your time frame? Because I got a bazillion phone calls.
I can hang.
Can you hang?
Yeah.
Okay.
All right. Well, let's blow through a couple more of these calls
Sure.
here. Hi. Good morning. You're on with T-Bone and Heather and Dr. Polsky. Welcome to the show.
Good morning. One quick question.
Sure.
What about people who are hypersensitive to chemicals and stuff? In other words, they can't take regular chemical medication.
Like what kind of medications? Like aspirin or ibuprofen or like...
No, the stronger medications that the doctors like to give out. In other words, my system's so sensitive that I can't take anything stronger than aspirin or sinus pills.
Okay.
So, allergic reactions have been very, very uncommon with any of the vaccines. For people who are concerned, that especially if they've had serious allergic reactions in the past, what we recommend is for them to make sure they get their vaccine in a place that if they should have a reaction, that there are trained healthcare providers that can respond quickly.
And is there a time frame? Like for example, when I got my injection, my vaccine, they said, okay, I'll hang around for about 15 minutes. Would you notice it? If you were hypersensitive, would you notice it in 15 minutes?
For people who have had serious reactions in the past, then we watch for 30 full minutes.
Okay.
But the other point to bring up is that people have to remember that if they don't get vaccinated, they leave themselves vulnerable to getting infected with COVID. If you end up with COVID, you're going to get hit with a lot of medications if you get seriously ill.
Right.
And would you rather, in a very controlled circumstance, get a vaccine, or in a point where your whole system is compromised by serious illness, then have to deal with a host of medications that are being...
Because they're going to give you medications.
Yeah, did that
Absolutely.
answer your question?
Well, you see, I'm not really, because like I said, they put me on naproxen and Ultramate at the same time, and I had the major
a reaction
side
to that.
effects. Yeah.
Well, I think what the doctor is saying, that it would be best to get the vaccine. You're not going to have a reaction to the vaccine like you would COVID and the medications that they would give you for your body to fight off COVID.
Good luck to you.
You'd have a better shot with the vaccine.
Thank you for the call.
Thank you.
Hi, good morning. You're on with T-Bone Heather and Dr. Polsky.
Hey, guys.
Hey.
Hey, my question is, has anybody worked the system and been so paranoid that they got, in line twice and got way too much? And is that a problem if you get, overdose of the vaccine?
Okay, good question.
I don't know if you heard any of that.
Thank you.
Unless somebody's using an alias, I'm not aware. It's like a medical record system that you would have at your doctor's office for vaccines. So when people register, that we make sure, because the important thing is we want to make sure that if you got a Pfizer dose the first time, you're getting a Pfizer dose the second time.
Yeah, right.
And so we do track, we do have a database there. And I'm not aware of people coming back for third and fourth shots.
Oh my gosh, I can't imagine.
Okay. Hi, good morning. You're on with Dr. Polsky and T-Bone and Heather. What can we do for you?
Hi, good morning. I'm not calling to stir up a controversy.
No,
It's
go
okay.
ahead.
What's on your mind?
I'm speaking from experience. My husband is extremely healthy. At the age of 60, he got his first COVID shot. Within 13 days, he developed blood clots in both lungs, and it was a Moderna shot. And the doctors have run every test possible trying to figure out why he had the reaction he had. And the only thing they can figure, that's the only thing that changed in his life, was the Moderna. He is not an unhealthy person. He's not on any blood pressure medication. He's not a diabetic. He's extremely healthy. He just had a huge physical done in February. And the only thing that I want people to remember is, in all of this information, you have to take everything with a grain of salt.
Yeah, I think you do, and I think Dr. Polsky will probably be able to respond to that. But I also think that people need to remember, and I don't mean this in any disrespect to your husband, but there are anomalies in every... I mean, somebody's going to win the lottery. It's not going to be you, and it's not going to be me.
No, it's not going to be me.
Unfortunately, I think your husband won the health...
Bad lottery.
Bad lottery?
Possibly.
If there is a thing?
Possibly.
Well, I will tell you, it totally blindsided us. It scared me to death.
Of course.
The worry of absolutely losing him. But
How
on the other hand, I understand you take risk with everything.
Yeah. How's he doing? How's he doing now?
Moderna's not reporting anything. He's doing fine. As a matter of fact, when it came time, they put him on blood thinners. He'll probably be on them for at least 6 months.
Right.
When it came time to get his second shot, the doctor's like, well, you're already on blood thinners. Go ahead and get it.
Okay. All right.
Okay.
Listen,
I was like, okie dokie.
Best to your family. Thanks for the call.
Thank you.
I mean, is that reasonable to say? I mean, there's going to be things. I mean, things are things.
Right. So first off, I'm happy. It sounds like her husband is recovering
and got help immediately.
At this point, and I'm sure that his doctors reported that into that VAERS system, and so it doesn't get ignored.
Good.
But to you're certainly correct. It's hard for me to speak to any one specific case.
Right.
But when it comes to blood clots, there are a lot of blood clots that we, as physicians, never really find out the
Nothing's
exact
100%.
cause.
Yeah.
There are hereditary factors that sometimes get brought out. We know about some of them, but we know there are others that yet we haven't discovered.
Yeah.
So I just want to make sure everybody's aware that the blood clots have been very carefully analyzed with both Moderna and Pfizer, and we have not seen any increase population-wide.
And it's interesting, she said her husband, when normally it's the women under 50. And her husband is 60 and a male, so.
Right.
I mean, look, the Heimlich maneuver doesn't always work. Stop, drop, and roll doesn't always work.
Right.
But we don't stop doing them.
I liked what she said, though, in the beginning. I don't want to cause a controversy.
No, I get it.
But I
get
totally
it.
get it, too.
Absolutely, I get it. And she's right to bring it up. But it's, I think you have to, that's what you have to weigh these things. And nothing's 100%. If it works 90 whatever percent of the time, pretty good deal.
And perhaps the scariest part of COVID are the blood clots associated with the virus itself. And so we've seen people with strokes, we've seen people with damage to their lungs and their kidneys.
So the virus, you can get blood clots as well.
Absolutely. So we've seen people in their 30s who end up with strokes or end up with long-term kidney damage as a result of blood clots from
the
COVID
virus
itself.
Wow.
Yeah. Okay, we'll do one more phone call, then
because we are really running late.
Oh my God. Hi, good morning. You're on the air with T-Bone and Heather and Dr. Polsky.
Hi, guys. Okay, so as T-Bone and Heather adequately pointed out yesterday, every news station puts a different political spin on the actual news.
Right, sure.
I did hear on one news station that the belief that the COVID vaccine was not adequately tested because it was pushed through very quickly is inaccurate, that it had the same level of testing as any other vaccine. They just got the funding a lot faster. Is that true?
That is true that they got more funding. The other aspect of that is that they were able to recruit people in much more quickly, and in order to show that a virus is effective as well as safe, you need a certain number of people in the control group, in the placebo group, who actually get infected. And so there were so many cases of COVID, they were able to show effectiveness more quickly. And they had so many people recruited in that they were able to accumulate safety data more quickly than for many trials of other vaccines in the past.
So they had a large group of people to test it on. They had money to test it. Those are two major roadblocks for your run-of-the-mill virus. And so these vaccines got to the forefront quicker because of that dynamic.
The other difference is that intentionally they made sure they tested a wide range of people. And what's been a problem for trials in the past is that oftentimes they just try it on healthy, relatively young
college
people.
students looking for $5.
In this case, there were, I can't remember the exact number, but off the top of my head, I would say about 15% of people were over age 75.
Oh, wow.
And for racial, ethnic diversity, they made sure that they had a much more representative sampling than what has happened in the past.
With people of color.
So that they were able to look at safety data, not just in young, healthy people, but in people with diabetes, people with other kind of health conditions. And so that really, I would say that in many ways, these COVID vaccines were actually the best tested vaccines that have ever been developed.
There you go. Thanks, caller.
Dr. Polsky, thank you so much for coming in today. We could probably go for 7 more hours. I appreciate it. I think there's a lot of information out of there, and some of it is good, and some of it maybe not so much. But I said this last time, and I will say it again. Thank you for you and your staff and the doctors
I got
and
a
the
question
nurses.
real quick. I'm so sorry. This just came in. Boosters. Are we going to have to get boosters?
What about boosters?
I want to separate that into two quick things.
Okay.
One is, so when I think of booster, it's the same vaccine that now you need to boost your immune system back up. At this point, there's no evidence that the vaccines that are currently available are wearing off.
Oh, okay.
And my sense is that probably that the Moderna and Pfizer, because it's a 2-dose, you get an immediate booster, that those will likely last for at least 2, maybe 5 years. The Johnson & Johnson likely will wear off a little bit sooner because there wasn't a booster dose. But again, still at this point, we haven't seen any evidence it's wearing off. The other, I think, that actually people are asking about is if there are variants that come up, will you need a supplemental vaccine?
Yeah.
Supplemental, not booster.
Right. So I prefer to use that term, and that's something that we don't know
We
at
don't
this
know
point
yet.
because we don't know what. I mean, there was a new variant that popped up in India about a month ago that almost everybody heard about this huge explosion of
crazy.
cases.
Poor India.
But fortunately, both the Moderna and Pfizer vaccines are doing a very good job in protecting. So people who were able to get those vaccines were not getting infected through that India variant, even though it spread more quickly. So we don't know what variant may pop up, and that is really an important thing for people to keep in mind, that the more unvaccinated people that remain, the more breeding ground for new mutations to develop. And so we all have in our interest not just what's happening right now, but come next fall and winter.
What could happen?
Right. The
What could be
fewer
out there?
people who are unvaccinated, the fewer chances for more mutations to pop up.
Okay.
All right.
Thank you.
Thank you again.
For everything you do, and to your staff and everybody who is out there, doctors and nurses all across the land. Thank you so much for keeping us on the right side of the dirt. We appreciate that. And I'm sure we will probably talk again. Thank you, sir.
Absolutely, my pleasure. And last quick is
Sure.
that if as questions continue to come up again, check with your doctor, check with your nurse practitioner. Don't stress about it at home. It is not worth the stress and emotional strain. Just go to a reliable source, and that is your licensed healthcare provider, not your
Right.
social media feed.
Yeah,
There you go.
All right, listen, we're crazy behind. Let's check the weather.